This is KZO Mornings. Jeremy Lawrence here with you. And with us on the phone right now is Dr. Eric Houchin with Bronson Family Medicine. Dr. Houchin, welcome to the program. So glad you're here.
Good morning. How are you?
Now, we wanted to have you on today to talk about, because, it's allergy season. There's already pollen in the air, and we're set to get some more in the air. It sounds like a recipe for lots of problems.
Well, absolutely. I think you have to take a good look at where we live and the state of the climate in West Michigan. We're a hotbed for allergies. That's certainly the fact.
Well, what are some of the things that we're going to be seeing here in the next few weeks that we need to be concerned about?
Well, certainly you're going to see a lot more tree pollen. The maple, cedar, and elm trees are going to be exploding here soon, and there's going to be a lot of pollen in the air. We're going to see it in our cars, on the ground, stuck to our clothes. We're going to be breathing it in, and those of us who are sensitive to it, we're going to suffer, and that's sort of the nature of allergy season. So I'd say everybody should be prepared to start stocking their cabinets with some symptomatic treatment.
Well, what are some of the most successful treatments when it comes to dealing with allergies?
Well, it's really nice right now in regards to options for patients and consumers. There's lots of over-the-counter antihistamines now, and I think for the majority of us, we want to pick the antihistamines that are non-sedating, that are not going to impair us, in terms of our function throughout the day. And so we're looking at meds like Claritin and Allegra and Zyrtec, and there's plenty of that over the counter. Some nasal steroids like Flonase and Nasonex are all available as well. So stocking up on those can certainly help with symptom control.
Now, is there anything that we can do in our homes that you think would help to mitigate some of that? Any, filters or anything that we can use?
Absolutely. I think it's tempting, when the weather is so nice outside and we've been running our furnaces all winter, we want to open our windows and get some fresh air in.
Mm-hmm.
And typically, the ambient outside air is actually more clean than our inside air, but not during this time of year. When it warms up during the day, most of the pollutants and pollens rise up in the air, and then when it cools down at night, it all comes back down and sort of settles, right where our window would be open.
Mm-hmm.
And so leaving the window open at night is sort of just leaving the front door open for allergens and pollens to come into the house. So a big thing is keep your windows closed at night, even though it's tempting to keep them open right now. Second is I would encourage everyone to consider using some form of HEPA filtration in their house somewhere, at least in the bedroom. Try to create a sanctuary of clean air in the bedroom, because that's, hopefully we're spending, a good 6 to 8 hours in there at night sleeping, and if we're breathing in lots of pollens and allergens, we're just going to be waking up all full of congestion and stuffiness. But if we can keep a sanctuary of clean air in the bedroom with a HEPA filter, that goes a long way as well. Vacuuming a lot, really trying to pick up any particulate pollen that could be on the carpet or on the floor or on furniture. If we're outside exercising late in the evening, taking that clothes off and put it in the laundry. If we're outside a lot in the evening, taking a shower and getting the pollen off of it makes a big difference as well.
I guess, every patient's a little different that comes in to see you, and there's different things that you do, but, just is there a standard that you turn to when somebody comes in and says, I got allergies?
Absolutely. One of the best old-fashioned treatments that I advocate a lot and get great response with is just good old-fashioned saline or saltwater irrigation of the sinuses. And there are a number of products out there where you get a little squirt bottle and you fill it up with some warm water. You put a salt solution that's buffered, and you can look up on the internet some recipes if you want to make your own. And then you really go at it and just irrigate the sinuses, get all that gunk out, and that can provide a lot of symptom control. Then at that point, now that you got all the mucus out of the way, you can really deliver your nasal steroid up on the nasal mucosa a lot better and get a better response. So first thing I would tell people is, hey, start irrigating with some saline. I think that makes a big difference. I would pick your favorite over-the-counter non-sedating antihistamine. And again, they're all fairly comparable. Everybody's got a little individual variability response with that.
Okay.
And then pick
Dr.
a nasal steroid.
Houchin, I am absolutely out of time, but thank you for the tips. We really appreciate your help.
You bet. Take care. Have a great day.